Good morning, Dr. Anthony, and thank you for joining us this morning for today's COVID-19 update. Minister, today is the 1 year anniversary of the administration of COVID-19 vaccines in Guyana. Can you say how we have progressed thus far?
Well, I think we have done very well so far. We are one of the countries in the Caribbean that would have vaccinated a substantial portion of its population. Over the last year, we would have been able to administer 850,735 doses of vaccines, which works out to be about 2,330 vaccines per day that we have administered. So I think that's a really good record that we have set, and I want to express my sincere thanks to the health workers and everyone who's been involved in the vaccination program. I would also like to express our gratitude to the various donor organizations because apart from the government of Guyana buying vaccines, we've also received donations from a number of countries, including India, China, the UK, Spain, uh, the United States, and through the COVAX mechanism. So all the countries who have assisted us, I would like to thank them for their generosity. And because of all of this assistance, we have been able to have such a strong vaccination program here in Guyana. When we look at the vaccines that we've administered so far, in terms of 60 years and over, first dose we are at 83.1%, second dose we are at 73.1%, and for the booster shots we are at 20.6%. The age category between 40 to 59, we are at first dose 82.8%, second dose at 67%, 67.6%, and booster shots at 10.1%. The age category 18 to 39, first dose we are at 80.8%, second dose at 56.5%, and booster shots at 4.6%. And then for the 12 to 17 age group, we're at 45.3% first dose and 32.4% second dose. So if we take the 12 to 17 age group, we would have had first dose at 45.3% and second dose at 32.4%. That's 12 to 17. Now, when we look across the region, it varies considerably. Region 9, for example, they have exceeded in terms of their first dose. In fact, they have gone to more than 100% in their first dose, meaning that they would have given out a lot more than what we have in the population database. And that might be because of persons coming over from Brazil who would have accessed the vaccine. Their second dose is at 85.6%, and as I said, their first dose exceeded 100%. So they're doing quite well. Region 8, they have 63.2% as their first dose and second dose at 48.9%. Then you have Region 1 at 62.2%, and their second dose is now at 37.5%. Region 6 first dose is at 48.8%, second dose is at 33%. Region 3 at 46.2%, and their second dose is at 33.8%. Region 5 they're at 44.2% first dose, and second dose at 35.8%. Region 4, their first dose is at 41.7%, and their second dose is at 29.9%. So that's below the average. Region 2, first dose is 41.5%, second dose at 29.9%. And region 7, first dose is 36%, and second dose is 25.9%. Region 10, first dose is 12.3%, and second dose is 6.9%. So we are working through CARICOM to be able to access these vaccines. And once we get the vaccine, then we will be able to administer it. Right now, because we don't have those types of vaccines, we are not able to give to children between 11 to 5 any vaccine. What we have is vaccines for persons 12 years and older. The vaccine that is for 11 to 5, it is about 1/3 of the dose that an adult would receive, and therefore it requires special arrangements, the dosage and all of that. So the manufacturer, Pfizer, has packaged it in such a way to make sure that there's precision in the dosing and the things that you need to mix the vaccines with, so that when you administer that, it's quite safe. So we will await until we can get those specialized doses before we have a program to administer vaccines between the ages of 11 to 5. So I think the essence of CARPHA's warning, so to speak, is really to alert countries not to use the adult dose and dilute it, but instead try and wait on when you can have access to the vaccines that are manufactured for this age group.
You have been watching the COVID-19 update for today, February 11, 2022. I am Shania Gonzalez. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. Goodbye.